Welcome to Module 5. In Module 5 we will be looking at respiratory medicine and therefore the respiratory system. Respiratory medicine obviously involves the respiratory system. We are going to look at the respiratory system, how things work, then we will look at the root terms, some suffixes, some common conditions and diseases associated with respiratory medicine and lots of words. The respiratory system. We have a diagram here. Let's find the nasal cavity at the top. You breathe in through your nose or your mouth and the air passes down through the back of your throat and down into your windpipe. Your windpipe then divides into two main bronchial tubes, one going into each lung. These bronchial tubes then divide into smaller bronchial tubes and eventually into bronchioles and tissue called alveoli, which are little sacs where the oxygen exchange takes place. When you breathe in, which is called inhalation, the diaphragm, a muscle below your lungs, contracts, and this causes the thoracic cavity, so your chest, to expand. As a result, air is drawn in to your lungs, and that's how you breathe in. On the next slide, we're going to look at the alveolar tissue, so the small little sacs where the oxygen exchange takes place. The alveoli. The alveoli are little sacs you find at the ends of the respiratory system. If you imagine the respiratory system is like a tree, the trachea, the windpipe, would be the tree trunk. The bronchus on each side would be the branches, which then divide into smaller branches, the bronchioles. And eventually at the end of the tree are the alveoli sacs. And this is where the oxygen exchange takes place. Around these alveoli sacs are tiny blood vessels called capillaries. And these allow the carbon dioxide to be released from the red blood cells. The carbon dioxide passes into the alveoli, ready to be breathed out. Oxygen from the lungs is taken up by the red blood cells and taken to the tissues in the body. This process of releasing the carbon dioxide and taking up the oxygen is known as gaseous exchange. Let's look at some root terms. Root terms. When we breathe in through our nose. So the root terms for nose are rhino, or nase or naso, but you can also breathe in through your mouth, and the term for mouth is oar. Remember, you see your oral hygienist. The air that you breathe in then passes through your pharynx, and the root term for pharynx is pharynx, and it means your throat. It then passes through your larynx. Larynx is your voice box. The air passes then down through the trachea. The trachea is your windpipe, and the root term for windpipe is trache. So for example, you may have heard of the term tracheostomy. From there, the air then passes into the dividing branches called the bronchus, or bronch is the root term for bronchus. These in turn divide into smaller tubes called bronchioles. And we know that the bronchioles then lead to the tiny air sacs, the alveoli. The term for lung as a whole is pulmo. So, for example, there would be the term pulmonary oedema, meaning fluid on the lungs. Or another term, pneumo, meaning lung, but it also means air. So you could have pneumonia relating to a disease of the lung. We could have a pneumothorax relating to air in the chest cavity. Surrounding the lungs are membranes known as pleura, and these basically stop the lungs from sticking to the chest wall. Let's use these root terms to make some respiratory terms. First of all, our trache, which is our trachea, our windpipe. Our word example, tracheostomy, and ostomy we know means opening, so it's making an opening into the windpipe. Bronch is bronchus, the tubes leading to the lung, so therefore a bronchoscopy, let's break it down. Oscopy is our visual examination, it's a visual examination of the bronchial tubes, or bronchi. Bronchioles are the small tubes, so bronchiolitis, let's break it down. Itis we know means inflammation, so it would be inflammation of the bronchioles. Pneumo is the word that means air or lung. Our word example, pneumothorax. So let's break this down. Pneumo, break, thorax. Thorax relates to the chest and pneumo is air. Let's see what's going on here. In this diagram we have a picture of a small pneumothorax, and you can see the picture with the grey lung, and the white behind it would be the air pushing against the lung. Also in the diagram is a picture of a large pneumothorax, and you can see how the lung has been pushed much smaller as the amount of air behind it is pushing against that lung. So therefore, pneumothorax means air in the chest cavity where it's pushing against the lung. Now, quite interestingly, pneumothoraxes can be left on their own without treatment because they're small and not causing any problems, but at the other end of the scale could be a medical emergency and the air behind the lung or the fluid behind the lung needs to be removed. Pulmo means lung. Our word example, pulmonary edema. Edema is fluid and pulmonary is the term for lung. So therefore it's fluid on the lungs. Thorax, well we know thorax is thorax, which is our chest. So if I have had a pneumothorax, I may require a thoracocentesis. Let's break this down. Thorax we know means chest. Centesis is a suffix meaning drawing of fluid. In brackets we have the term thoracentesis. It means exactly the same thing, and it means drawing of fluid or air from the chest. And spiro means breathe. A patient may go for spirometry. Well, let's break it down. Metry means measure. Spiro is breathe. So spirometry means measuring the breathing. And when they're measuring the breathing, they're looking at how much air you can push out in 1 second and also how much air you can push out as a total volume. And these results would help decide on the level of lung disease you may have. So we know that spirometry means measuring the breathing, but before you go for a spirometry test, the doctor or the nurse would listen to your breath sounds using a stethoscope. The term auscultation is the process of listening to the lung sounds or the breath sounds and also body sounds. And to do this they use the stethoscope. We have a picture on the right hand side here. Some of the sounds they may hear they may describe as crepitations or crackles. And these are crackling and rattling noises made by one or both lungs with a respiratory disease. And lastly on this list, wheeze. It's a coarse whistling sound caused by narrowing or obstruction of the airways. And let's look at some of the reasons for those. A very common lung disease is called chronic obstructive pulmonary disease, or COPD. Now COPD actually is a combination of something called emphysema and chronic bronchitis. So emphysema is part of COPD, chronic obstructive pulmonary disease. And what emphysema actually is, it's when the alveoli sacs, where the oxygen exchange takes place, become dilated and destroyed and scar tissue is laid down. So therefore, oxygen exchange is obstructed. Let's have a look at a couple of diagrams. On our left we have the healthy alveoli, so the sacs looking all lovely. On the right hand side we have emphysema. And what we have here is damaged air sacs. You may be able to see on the diagram how little bits of air have got trapped within those sacs. The sacs of the alveoli are weakened and there's scar tissue and damage. Emphysema and chronic bronchitis together are known as chronic obstructive pulmonary disease, COPD. It's chronic, it's ongoing, there is no cure. And it is diagnosed through spirometry. So spirometry we know is measuring the breathing, and it's the best pulmonary or lung function test available for early detection of many lung disorders. And COPD is common. And the main cause for COPD? Smoking. Let's look at some more suffixes. Here, our first one, we have nia, meaning breathing. Dyspnea means difficulty breathing. So nia is our suffix for breathing. Dyspnea, difficulty breathing. You don't pronounce the P. But in the next word you do. So apnea. And A at the front of a word means no, so you're not breathing. Tachypnea. Tachy means fast. So tachypnea would mean fast breathing. Next one, metry means measuring. Spirometry, measuring the breath. Audiometry is measuring the hearing. Audio was hearing. Tussus is coughing. So hemoptysis is coughing up blood. Centesis means drawing off fluid. So a patient may go for thoracocentesis, which would mean drawing off fluid from the chest, or the second word here, pleurocentesis, which means drawing off fluid from the pleural membranes. The pleural membranes are the membranes surrounding the lung. Plasia means formation or growth, so you may hear the term dysplasia of something. In orthopaedics we had the term dysplasia of the hip. Dysplasia would mean disordered formation or growth. It's time for you to think about the terms on the left-hand side, and then you're going to match them up in your head to the terms on the right-hand side. So you don't have to press any buttons, I just want you to think about it. So the slides we have covered, just recently in fact, just to see if any of it's sunk in. Let's go. Nia, phasia, plasia, itis, centesis, plasty, osis or iasis, metry. Have a think to see where you think they would go, these terms. Right, press my magic button. Ta-da! Nia, breathing. So we had dyspnea being difficulty breathing, or apnea, without breathing, tachypnea, fast breathing. Phasia was our word from the ear, nose and throat section. Phasia is a suffix meaning speaking. So if I have dysphasia, difficulty speaking. Plasia looks similar, doesn't it? Plasia with an L. Plasia means formation or growth. So dysplasia is disordered formation. Itis, inflammation of. Centesis was drawing off the fluid. So we had thoracocentesis or pleurocentesis. Plasty means surgical repair. Rhinoplasty would be surgical repair of the nose. Osis and iasis mean condition or disorder. And metry is measure. Spirometry, measuring the breathing. Asthma. Asthma is a very common condition. It affects thousands of people and it can affect children and adults alike. Some children will have asthma from a very young age, but will grow out of it, whereas others will maintain the condition throughout their lives. In a normal lung, the air passes in to the alveoli sacs and the oxygen passes through. In an asthma attack, the bronchial tubes and the muscles within those tubes contract, making the airways narrow. So air can come in, but it's actually hard to get the air out. Often with asthma as well, there's a build-up of mucus. The amount of mucus secreted does increase. And a common thing to occur is in children, they may have asthma, but it becomes more severe if the child has a cold. So asthma is a chronic inflammatory airways disease with narrowing of the airways, which is bronchoconstriction, and bronchospasm and wheezing, the wheezing sound being when you're trying to force the air out of your lungs. Asthma is considered a reversible condition and may be called reversible airways disease. So patients will take medicine to help dilate their airways, open up the airways, making it easier to breathe. General terms. We've covered some of these already, so let's recap and see if we can remember what they mean. Oedema or oedematous means fluid, and this is fluid that can actually cause swelling. An example and associated with the lungs would be pulmonary oedema, so that's fluid in the lungs. Effusion is another term for fluid. So we could have pleural effusion, so this would be fluid in the pleural membranes. Or hemothorax is actually a type of effusion. It's when you have blood in your chest cavity. Embolism is a travelling clot. Commonly, if you think of a clot, you think of a blood clot. A pulmonary embolism would be a travelling clot that has ended up or landed in the lungs. Constriction means getting narrower. As in asthma, you can have bronchoconstriction, so narrowing of the bronchial tubes. Dilation means getting wider. So with treatment, in asthma, you have a bronchodilator, which causes bronchodilation, which means that the bronchial tubes will get wider, making it easier to breathe. Obstruction is a blockage. So with COPD, chronic obstructive pulmonary disease. Let's look at some prefixes and recap some of the prefixes we've already done. Ortho means normal or straight. Our word example here is orthopnea. So ortho is our normal and straight, and nea is our suffix meaning breathing. So you have normal, straight breathing. A better way to put it, normal breathing when upright. Some people, because they have pulmonary edema, a build-up of fluid in their lungs, will not be able to sleep well if they're lying flat, because they won't be able to breathe particularly well. But if you sit them upright, the fluid will drain down to the bottom part of their lungs and they'll be able to sleep and breathe in a bit more comfort. Pi or pio is pus. Pneumothorax. Let's break it down. Pio, break, pneumo, break, thorax. Thorax, hopefully you remember, means chest. Pneumo, in this case, is going to mean air. And pio, pus. So together, it's pus and air in the thorax, or in the chest cavity. Brady is slow. So I may have bradypnea, which would mean slow breathing, or a slow breathing rate. Hyper means excess, raised, too much, increased. So hyperpnea would imply excess breathing or increased breathing. Let's give it a bit more definition. It is increased breathing, but it relates to the depth of your breathing. So you're breathing in really deep breaths rather than fast breathing. As in the next one. Tachy is fast, so tachypnea is fast breathing. and this relates to fast, shallow breathing. And next it's time for some abbreviations. Let's look at these abbreviations. We've covered most of these before, so let's have a recap, starting with COPD, chronic obstructive pulmonary disease. Now this is the classic smoker's disease, where you get damage to the alveolar sacs, which is known as emphysema, and chronic bronchitis. These two conditions together are known as COPD. PFT is the term for pulmonary function tests, or spirometry, measuring the breathing. CXR will be a chest x-ray. PE is our pulmonary embolism, and the embolism was the travelling clot that landed in the lungs. If you have a pulmonary embolism, you will probably be sent for a VQ scan, just to check. And this is what a VQ scan looks like. VQ stands for ventilation and perfusion scan. So what they're looking at is how well the air passes through your lungs and how good the blood supply is. So it's a test that compares the right and the left lung function. SOB, short of breath. SOBE, shortness of breath on exertion. And URTI it's sometimes called, URTI, upper respiratory tract infection. And lastly on this page, LRTI, lower respiratory tract infection. We've covered all the information in this module, so it's now time to break down some words and recap a few of the terms we've come across. So let's start with our list of words. We have tonsillitis, rhinoplasty, otorrhea, otalgia, otitis externa, audiogram, dacryocystogram, tracheostomy, bronchoscopy, bronchospasm, pulmonary edema and pneumothorax. I'm now going to show you the list with the breaks in. I'd like you to look at them and see if that's where you would have put the breaks. So tonsillitis, well itis is our suffix, the L is an extra L, and tonsils are tonsils. So it means inflammation of the tonsils. Rhinoplasty, well plasty is our suffix, rhine means nose, so rhinoplasty is surgical repair of the nose. Otorrhea, orrhea is our suffix, and orrhea means discharge or flow, so it would be a discharge from the ear. Otalgia, algia means pain, so otalgia is pain in the ear pain. Otitis externa, well externa means external, itis is our suffix, so this term would mean inflammation of the outer ear. Audiogram, gram is our suffix, audio or audio is the root term, gram means tracing, so it's tracing of hearing, it's hearing tests. Our next one, dacryocystogram. Well, dacry, remember the clue there, you cry tears, cyst is a sac, so it would be a tracing of the tear sac, gram being tracing. Tracheostomy, ostomy means opening, and trache relates to the trachea, which is your windpipe, so tracheostomy would be opening of the windpipe, when you bring the trachea to the skin surface so the patient can breathe. Bronchoscopy, oscopy is our suffix, and oscopy means visual examination with a lighted instrument of the bronchial tubes. Bronchospasm, well spasm just means spasm, so muscle spasm really, so this is quite simple, it's spasm of the bronchial tubes or bronchi. Pulmonary edema, edema means fluid, pulmonary, well, it's a bit tricky to break that one down, so we're just going to keep it whole. So pulmonary edema means fluid on the lungs. And lastly, pneumothorax. Thorax meant chest, pneumo is air, so it's air in the chest or air in the chest cavity. Let's look at some more. Here's our terms: pleuritis, tachypnea, orthopnea, hemoptysis, spirometry. Where do you think the brakes may go? So looking at the first one, pleuritis. Well, itis means inflammation of, so it would be inflammation of the pleura, which is the membrane surrounding the lung. Another term meaning exactly the same thing would be pleurisy. Tachypnea. Nea is our suffix meaning breathing, so it would be fast breathing. And you may remember it was fast, shallow breathing. Orthopnea. Nea we know is breathing. Ortho meant straight and upright. So this was the one where you mean normal breathing when upright. Hemoptysis. Tussis means cough, and hemo is blood, so it's coughing up blood. And lastly, spirometry, or spiro means breathing, metry is measuring, so spirometry is measuring the breath or measuring breathing. Let's recap these general terms. Prolapse means falling out of place. An example would be a prolapsed intervertebral disc, one of the discs of cartilage between the vertebrae and your spine popping out of place. We sometimes call it a slipped disc. A bulging disc would be more appropriate. And this links us with the term hernia. A hernia is when something protrudes out of place, pushing through a containing wall. So another term for this prolapsed intervertebral disc would be a herniated disc. It's bulging out, it's protruding. Externa means outer or outside. So we could have otitis externa, inflammation of the outer ear. Media is middle. An example would be otitis media, inflammation of the middle ear. Chronic is ongoing. So I could have COPD, chronic obstructive pulmonary disease. Acute means sudden onset. So I might have an asthma attack. It might be acute, it might be sudden onset. Oedema is fluid. So you'd have pulmonary oedema, fluid on the lungs. Effusion also means fluid. And I could have otitis media with effusion. So that's when I'd have a build-up of fluid in my middle ear. Embolism is a travelling clot. So a pulmonary embolism would be a travelling clot that has landed in the lungs. Constriction means getting narrower. Bronchoconstriction would be narrowing of the bronchial tubes, as in an asthma attack. Dilation is getting wider, so bronchodilation would be widening of the bronchial tubes. And the term obstruction means blockage, but here's another word meaning blockage as well, which we'll come across shortly: occlusion. Occlusion means blockage. That concludes Module 5. It's quiz time. If you need to go back and look at anything again, please do. Otherwise, go to your left and you'll find where the quizzes are.